Greetings, comrades. Hope this finds you well. Quick shout out to INN, the Indian News Network, which I'm stoked to be a founding member of. Christiane wants a shout out. She doesn't get one. I give shout outs to INN and then the two Uber comrades supporting my channel, my partner, and Indie Left News, but she's neither of those people. She gets on that level of support on Patreon. She'll get a shout out. There's your shout out, Christiane. What? I have two favorite daughters, so she can't get that either. One of my favorite daughters. There's your shout out. Anyways, before she so rudely interrupted and distracted me, I wanted to talk about this Democratic state representative in Illinois introducing this bill that would require unvaccinated people to pay for their own COVID care, and this is in the state of Illinois. I think this is obviously problematic for, a lot of reasons. Obviously, we shouldn't be fucking segregating off who receives health care. Isn't the healthcare fields like professional code of ethics, the Hippocratic oath is first do no harm. It's not, Jesus fucking Christ. So this is ridiculous on a lot of levels. We should be expanding healthcare. Imagine the hundreds of thousands of lives that would have been saved during the pandemic if we had Medicare for all, if we had universal health care, because again, around 68,000 people die each year in the United States because they don't have access to health care. So I think this is a bad idea on a lot of levels. So we'll check out this story quickly, but I think this is a very problematic bill. Let me know in the comment sections. Do you think this is a good thing? Is this really, ridiculous and authoritarian and harmful, as is my perspective on it? So there you go. Illinois State Rep introduces bill requiring unvaccinated residents to pay for their own COVID care. State Rep Jonathan Carroll filed HB 4259 on Monday in Springfield, Illinois. Obviously, legislation would impact those residents who choose not to receive COVID-19 vaccines, will require them to cover medical costs associated with contracting the virus, even if they have health insurance. Carroll says the bill would serve as an incentive to residents to get vaccinated and would help curb the spread of the virus in Illinois. If you get life insurance, you're a smoker, you pay a higher premium than those who don't. He said the insurance companies have things like that built in red. Again, we shouldn't have fucking insurance companies. We should have a single payer system where all medical care, whether it's COVID or, regular stuff or orthopedics or surgery or mental health or physical therapy, what it is, free at the fucking point of service. United States, we pay more for healthcare than any country in the world, and yet not everybody is covered. This is a fucked up system. Unsurprisingly, Illinois Republicans have pushed back against the measure, including Rep. Adam Nienberg, who introduced his own ledge that says would protect unvaccinated Illinois from being discriminated against for refusing the vaccine. And again, some of the research that I've seen on why people haven't gotten vaccinated in the United States, or people who are hesitant to, or people who maybe are waiting to, one of the reasons is that they're working class and they can't necessarily get the time off from work to recover from getting the jab, right? So we shouldn't be, if the goal is to get more people vaccinated, we should be encouraging, educating, giving people incentives, actually having, the government both on a state and a federal level doing things to improve the material conditions of people's lives. Also the fucking pharmaceutical industry should obviously be nationalized in the United States, along with the just healthcare industry in general, right? There should never be a fucking profit motive involved in taking care of people, because again, that's always going to be placed above, the need of taking care of people, right? And that's kind of endemic problem to capitalism. Profit gets put before, the needs of the people, needs of the community, needs of the planet, etc., because the profit motive reigns supreme. So I think, again, this is just really stupid and problematic on a lot of levels. And again, it gives, conservatives and Republicans a lot more ammunition to run against Democrats when they have these fucking really stupid policy ideas, instead of actually, looking for ways to improve the material conditions of the working class. They look for these stupid punitive and authoritarian measures that, aren't going to do anything except, make people, double down. It's like, well, fuck you then. Like, this is ridiculous. Let's, go campaign against the person that introduced this. And again, a lot of people who are hesitant, who haven't gotten the vaccine yet in the United States, are very much of the, working class, and they don't necessarily have, the means to take off work and potentially miss, a couple days, 2, 3, 4 days of work from getting, the COVID shots. So again, it's like just so many fucked up reasons why this, shouldn't be happening, but not surprising, frankly, right? Like the video if you like the damn video, subscribe for more content, all part of the people. Let me know what you think down below about this Democrat, state representative introducing this law in Illinois. Peace.